Hi, I'm Liv from Work It Health, and I'm with Dharma, who we're both going to discuss harm reduction in relation to pride. So let's start with Dharma. Do you want to tell me a little bit about yourself?
Yeah, so hi folks, I'm Dharmakrishna Mirza or Dharma. I use she, her, hers pronouns. I am a queer, transgender woman of color, mixed race. I'm also a Wajah Sara, which is a Pakistani third gender tradition in Lifeway. Um, I guess some of my other locations are that, I'm being queer, trans, Wajah Sara. I'm also a former IV drug user. I identify as a person in recovery. I identify as a junkie, specifically a queer junkie. I was a longtime Chem sex user. I'm disabled, HIV positive, first generation immigrant. And a lot of those things inform like why I'm involved with harm reduction and pride and everything too. But beyond that too, I guess I'm a student currently finishing my undergrad at Oregon State University, doing a bachelor's degree in public health, health promotion, and health behavior with a minor in queer studies and medical humanities. I'll be starting my master's degrees in the fall at Oregon State, doing an interdisciplinary studies program in women, gender, and sexuality studies and adult higher education, as well as a master's of public health. I am involved in recovery in a lot of other ways too. I am the Equity and Justice Fellow for the Association of Recovery in Higher Education. I also serve on the Oregon Health Authority Measure 110 Oversight and Accountability Council that kind of oversees the grants and rulemaking from our drug decriminalization last year here in the state of Oregon.
Thank you. I love your perspective, which and I really appreciate you taking the time to do this, especially on a Sunday. So I thought I'd just start by giving a background to how we got onto the discussion of harm reduction. I was talking about pride on Facebook and different perspectives to include, and you said, let's include the concept of harm reduction. So I'm hoping that you can talk a little bit about that for our viewers and what, I guess specifically what you mean by harm reduction.
Sure. So I guess to start off, why I think it's so important is that, it's pretty clear that LGBTQ plus communities face disproportionate rates of substance use disorders. And beyond just the pathology of a substance use disorder, queer and trans communities face a lot of oppression, and a lot of that oppression is internalized and externalized through unhealthy or maybe less safe coping mechanisms. And so we know that a lot of the burden of not just substance use disorders but chemical use in general really affects the queer and trans community, particularly queer and trans people of color and transgender women of color, specifically Black trans women. And so these things are really embedded in our community and our cultures, but then also, kind of understanding some of the cultural histories of queer and trans communities, that, like, for instance, the concept of the gay bar is so critical to LGBTQ plus organizing, right? And not, not without good reason, right? Like, queer bars were the kinds of locations that kind of helped to facilitate wider queer and trans liberation movements, right? Like Stonewall. We think of these kinds of places. However, what's come alongside of that is a culture of hyperconsumption. Especially as pride has been commoditized more and more, turning into these big kinds of capitalistic, rainbow capitalist kinds of events that are more focused on like hyperconsumption, if it's money, if it's drugs, if it's, sex, whatever it is. And so this culture of hyperconsumption, I think, really informs why we need harm reduction.
Right. And just this sticking of a rainbow on it and calling it pride really doesn't encapsulate like the depth of, and Chantel and I are going to have a discussion about this, about the depth of the activism that took place. Like when we think about pride, we just, you know, yeah, we think about rainbows and consumption. We don't think about like the struggle of specifically, you know, people of color and trans folks who have really liberated us for the movement of Pride. But it's unfortunate, and so in the space of harm reduction, I feel like it's kind of been co-opted as a term in the recovery movement, and you know, where we just think about harm reduction and in terms of medication assisted treatment. What do you think about that and about kind of the broader spectrum of harm reduction initiatives that are out there?
So I guess to start off too, I think it's really critical that we locate the origins of harm reduction in the HIV and AIDS crisis, which, you know, obviously disproportionately impacted queer and trans folks, especially trans women of color, sex workers and other folks. And two, to the last point, the last question as well, you know, it's really important to realize that like some of the leaders of like these trans women of color that people celebrate were also drug users and struggled with substance use. Like Sylvia Rivera talks about being a junkie, yet we discard queer junkies in society today, especially the trans femme junkies like myself, right? And so like I think too, so thinking about where harm reduction actually comes from, this HIV and AIDS crisis, it's so important that we acknowledge that too, because the only reason that we see all of this momentum for harm reduction movements, recovery movements, stemmed from the really mismanagement of people's, or not maybe mismanagement of people's, but like the mismanagement of health systems to actually care for people. And so what we realized out of the HIV and AIDS crisis was that like we needed an alternative form of providing care that was focused on reducing the harms without making people change their health behaviors or their life ways. And I don't think they're just health behaviors, right? These are people's life ways. They've how they learn to survive. They're how they're coping through trauma. But so what's actually happened is that the whole recovery movement has kind of co-opted harm reduction from the HIV and AIDS movement. And so, but with intention, right? Because we know that a lot of the reasons why we practice harm reduction are to reduce infectious disease, especially HIV and AIDS. Things like syringe exchange, right? Like these stems that are critically rooted in HIV and AIDS resistance and survival movements. You know, which also speaks to the queerness of harm reduction as a praxis, right? That this came from generations of lost queer and trans people, people like myself who couldn't survive off daily medication, who didn't have access to things like PrEP or PEP, right? And so, you know, that's a huge part of it. But I think too that for me, harm reduction is so much more than just the reduction of the harms associated with drugs, right? There's a quote from Charles Hawthorne from the San Francisco AIDS Foundation, that harm reduction is one way to help process some of our experiences of trauma, in that we don't minimize, ignore, or overlook the real or tragic harms that can come from illicit or illicit drug use. In fact, we have to be pragmatic, realistic, and informed in order to find solutions to minimize or prevent harms. And
I love
for
that.
me, it's really great. And I think that for me, harm reduction isn't just about, you know, doing something in your office. It's not just about syringe exchange. It's not just about HIV AIDS prophylaxis. It's about taking a commitment to the safety and well-being of people in our communities. And so for me, you know, harm reduction starts when you walk out of your front door, and that your communities are held safe. You know, it's not just keeping people who are coming into services, you know, getting them reductions from harm. It's, you know, making sure that the person passed out on the sidewalk who is homeless is safe, and making sure that we have spaces to use drugs so that we're not dying trying to cope with the harsh realities of systems of oppression, especially as queer and trans people. And so for me, harm reduction really is about attending to these different kinds of care, right? Understanding that the medical systems have been white supremacist, ableist, and a form of carceral systems in the United States. That like forced institutionalization is heavily tied to queer and trans identities, and that we experience really wide disparities in accessing recovery services in general. Not that those kinds of models for care are even made for us, right? programs like popular 12-step programs were designed, 100 years ago for white cishet men who wanted girls like me dead. And so it's kind of just understanding that harm reduction isn't just like an alternative model for us, it is the model for us, and that recovery through abstinence only models is the actual alternative, right? Like that's the way, there's a veil around what the reality is on good care and actual like disability justice, healthcare justice. And it's not through abstinence only models for sure. And it's not through reductionist kinds of pathologizing of individuals who are forced through systems of oppression to use drugs, right? Yeah.
What an amazing answer. I could listen to you talk all day. It's such an incredible perspective that I think we really need to bring to the fore when we're considering the vastness of harm reduction. And I love what you said about, I guess, the veil around recovery, right? That it's more about harm reduction than it is about absence recovery being the gold standard. Like, I feel like that perpetuates this hierarchy of recovery that actually doesn't exist, right? All that does is harm and further oppress people. And now,
and I think the reality too is that abstinence only approaches are part of harm reduction.
yes.
And that like harm reduction is the continuum, right? It's
Yeah.
not antithetical to abstinence only models, because it's certainly been effective for a lot of people, or it wouldn't, but it's not effective for everyone, and it shouldn't be expected as the norm, right?
Yeah.
And so I think too, it's about understanding that harm reduction can include, abstinence only pathways to recovery, but that hierarchical nature of the separation between, abstinence only programs and harm reduction is what's really stratifying that issue more.
Yeah, I agree. And bringing it, we've talked about like the scope of initiatives of harm reduction briefly, and I'm bringing it back to Pride, as we're going to focus on that next month. Like, what are there specific harm reduction practices that we could center for the celebration of Pride?
Yeah, first and foremost, I think, is the coordination with sexual health harm reduction programs, right? Like, it is so imperative, because we understand that, like, for a lot of queer and trans folks, queer, trans, intersex, and other folks, that our addictions or our chemical use is tied into our sexualities, our gender, and our sex. And so it makes sense and is really necessary to, also, as we approach chemical symptom or issue reduction, that we're also looking at reducing harms related to things like chem sex, or this party and play culture that is pervasive in queer cultures. And so I think for me, some of the key other things too is that, it is like at recovery representation at Pride, that it has to represent also harm reduction, right? That we know people are going to be doing things like binge drinking. And so, and especially as we're coming back from a year of lockdown, right? That like my concern and what the reality is that a lot of people are going to come back, and they're going to come back hard, right? This is the Pride that they're making up for all this last year. And so people are going to be, consuming more chemicals than they would be normally. They're going to be doing, engaging in polysubstance use. And so it's really about educating people about, like, these are the effects of drugs, and this is what happens when you mix certain drugs together, to really understand. What's also really critical is reductions for the impacts of fentanyl, because a lot of I think there's this illusion that, most people are just drinking and using alcohol and using cannabis, but people are using, opiates, they're using benzos, they're using stimulants. And we know that fentanyl is getting into all of these supplies, right? It's getting into methamphetamine, it's getting into Xanax, it's getting into what people think are ecstasy, or Molly. And so it's like understanding or getting out testing strips and testing supplies is really important, but also educating people on how to properly test things, right? Like understanding the difference of how to use your fentanyl test strips for when you're using meth at Pride versus when you're testing heroin, right? and really making sure people understand those, getting things like Narcan out at Pride, understanding that like every overdose on opiates is preventable if we can get people the care that they need, and understanding that like overdoses are disproportionately centered among queer and trans people of color, especially Black trans women, and understanding that like our decisions as recovery providers and folks involved in harm reduction movements, as harm reductionists, to not provide Narcan and these kinds of things at Pride is a form of killing our own communities, because we're celebrating we're celebrating Pride, we're pushing people into hyperconsumption, we're not providing things to keep them safe, and it's literally killing people. I think some other things that we should focus on are like ways to safely use drugs more, right? Like it's that people are going to use no matter what. And so it's not just reduction stuff. It's not just overdose reversal either, right? Because a lot of the times it's the bare bones. It's like what people can get. It's like, you know, well, we'll stop them from dying by reversing them by giving them Narcan or testing their drugs. But it's also about teaching them how to use their drugs safer, right? Like teaching people safe boofing techniques, teaching people you know, especially chemsex, I think is something that really needs to be talked about more, especially in Pride and Recovery, LGBTQ plus recovery organizations, because we know that there's a growing epidemic of sexualized drug use in our communities, and that it's literally killing so many gay men, queer men, and transgender women. Right?
I was just talking about that this morning, and I came across a guy called David Stewart. Have you heard of that guy? I think he's in England. Who talks specifically about chemsex and harm reduction.
Yeah, and I think a lot of the research has come out of the UK, and work from folks like Dr. David Fawcett, and internationally too. We see it. I've done a lot. I've been looking into research over the last year about the increase in chemsex in South Asian and Southeast Asian populations, and how this is a global epidemic that's increasingly concentrated in queer and trans communities, but also with communities of men who just have sex with other folks, right? Men and transgender people, and understanding that chemsex, especially stimulant usage, has a significant impact on people's sexualities, straight, cis, whatever, right? And so that's, I think, something that's really important to talk about very explicitly too, is the dangers of chemsex, how to safely combine drugs, like, you know, warnings about mixing like things like GHB with alcohol, stuff like that.
So I just wanted to go back to you talking about the education piece, right? Let's say, you know, someone's listening to this and they're thinking, okay, yeah, I want to learn more about how to use drugs safely. I want to learn how to get a hold of Narcan. I want to learn how to use Narcan, you know, or how would someone access those resources?
You know, I guess that depends on where they're at. I think that some really good places to start are HIV and AIDS organizations, because they are so tied into actual harm reduction, that's always a great place to start. Identifying if there is queer and trans inclusive harm reduction groups in your area, but you know, navigating those systems can be very difficult, and so it's kind of depends on where you're at. I think that you know, it's you know, projects like the, you know, Students for Sensible Drug Policy, the Harm Reduction Coalition, these kinds of like wider groups really are great at guiding people towards resources in their regions. And I think online there's a lot of information too.
Yeah, and most pharmacies will allow you to now get a prescription for Narcan. And there are so many harm reduction coalitions, like you mentioned, that will send it out to you. It's really just at the tip of your fingertips. It's called Google. But
that's a big thing, is that I think that people have to take that onus of responsibility, is that like, if you want to engage in Pride, it is also your responsibility to identify, is there harm reduction services there? What harm reduction services are missing? And then locating those for people in your community. Because a lot of times what's happening is that labor falls on queer and trans femmes, especially trans femmes of color, who are also surviving through addiction and recovery, right? But that like a lot of that onus falls on us. And so it's kind of just identifying those things in your community, right? That like harm reduction is a continuing practice to identify those services for people who are more marginalized than us as well.
That's such a critical point. I think when people think about queerness, they think about sexuality, they don't see it as an action. You know, and that we live in an individualist society in America, and the kind of concept of taking responsibility, I think, is so important. Thank you so much. Those were my questions. Is there anything that you want to add?
I think too that like a really, if organizations themselves can't provide some of these things, it's like, what do you do next? And it's you do what you can.
Yeah.
Right? Like even if it's you just have condoms, even if it's you just have, Narcan, even if it's, you're just educating people on these things, do something, right? But that too, that harm reduction needs to mean that we're keeping Pride safe, that we're not keeping capitalism out of Pride is harm reduction. Reducing the financial costs associated with accessing Pride or Pride activities is harm reduction. Offering alternative Pride events that aren't centered around substance use or that are substance free, family friendly is harm reduction. But I think what's most important too for me now is getting cops out of Pride is harm reduction, right? Like we know that there's such a harmful relationship, especially with BIPOC and Black trans folks in our community. There's not a problem with them. There's a problem with white supremacy and white supremacists and cops coming in and policing Pride. And it's like, it's really critical to harm reduction and for the mental health and well-being of especially queer and trans communities of color that we, don't have cops at Pride as a form of harm reduction practice.
Yeah, I think that's critical. Thank you so much for your time. I really appreciate it.